Now to Mariella from Wisconsin 38. Mariella?
Hello, thank you for that opportunity. Can you hear me?
Yes, we can.
Thank you so much. I have a few questions. This is a combo, and I know that it's not a lot of time, but there is a lot of concern in the low income, the Latino, and the undocumented community. Question number one will be if they are having any access to free healthcare, free testing, in clinics and hospitals as well, free because they have no insurance. And then also if there is going to be any economic relief in the state for the undocumented. Another concern is why having employees being ordered to keep the employees' workplace safe for some companies who are endangering their employees by potentially exposing them to coronavirus. And my last question is, if your doctor has ordered to quarantine, when you apply for your employment, people are concerned about the questions if you are qualified to work, if you answer yes or no, do you refuse to work? Thank you so much.
So I'll take the first one, Mariella. Cost should not be a barrier to testing or to treatment, and both through our work at DHS, through the work that the Office of the Commissioner on Insurance has done in partnership with private sector insurance, folks are working hard together to ensure that cost is not a barrier to testing and treatment, and a number of companies have said publicly, have asserted publicly that they will cover tests and treatment. So I do think it's important for folks not to avoid needed care because they are uninsured. We need to make sure that folks who are having symptoms can call a clinic, can call a physician and get guidance about what they need to do to either to seek treatment or to get a test. And so I really do want to make sure that people hear clearly that cost should not be a barrier to access for needed health care as it relates to COVID-19. On some of the other questions, I think that there are other folks here.
Yeah, I'll just speak to the issue of safety in the workplace. Those issues are with us in a COVID-19 environment or a non-COVID-19 environment. Employers, and we have great employers in the state of Wisconsin, have to comply with federal and state laws regarding safety in the workplace. That is not any different now than it was before, and there's complaint procedures under both state and federal law to do investigations of that. And I just want to turn it over to Ryan just for a second on the unemployment insurance question.
Sure. So that was addressed with the emergency order number 7, addressed the eligibility for unemployment insurance as it relates to somebody who has COVID-19. And to follow up on what the governor said about employer safety, it is important that even employers who are essential businesses, the safer at home order does require them to implement social distancing and other practices to the greatest extent possible, just to address those concerns in terms of keeping people who have essential jobs, that they're still staying safe to the greatest extent possible.
And then the third question was about quarantine, and I'll take that because I think it's a good opportunity to review what that means exactly and how important it is. So the safer at home order is our biggest intervention that really affects the whole community, the whole state. Safer at home means we want to reduce the number of people who come into contact so the virus doesn't spread as much without us knowing it. But when we do identify individuals who have coronavirus infection, quarantine and isolation, those are the two biggest public health tools that we have to prevent small outbreaks from becoming big outbreaks. So isolation is what we say when someone is ill with COVID-19, we need to isolate them, we need to keep them safely separated from other people so they don't transmit the virus. What quarantine means is among people who have been exposed to someone with the disease but don't yet have any illness, we need them to remain physically separated from other people so that in case they develop symptoms of the disease or if they develop the illness without a lot of symptoms, they're not spreading it. So the important thing about quarantine is that, number one, it's for people who don't have symptoms but who have been exposed to a person. And the second is that it's not forever. So it's 2 weeks. That's the amount of time that we think is the period where someone who might become exposed to the virus would develop symptoms. So really, as we get into the specific cases where someone is a household member or someone been in close contact with in the workplace who has been exposed, quarantine is really the fundamental public health strategy to keep them separated from other people so then they don't spread it to other people. So that's a good reminder of what our tools are at the local level when we do have cases.
And just one more thing about workplace, safe workplace practices. A number of healthcare folks, as well as business leaders, have prepared a list of safe workplace practices during this crisis. It's on the DHS website, and if there's any questions about what those are, I'd sure check that out, both if you're an employee and an employer.
Thank you, Mariella.